In May 1847, a young Hungarian doctor instituted a policy that seemed absurd to his colleagues at the Vienna General Hospital. Physicians and medical students were required to wash their hands in a solution of chlorinated lime before examining pregnant women. The senior staff protested. Wash their hands? The suggestion was insulting. Physicians were gentlemen, educated professionals whose hands could not possibly carry disease. Yet within 2 months, the mortality rate in the obstetric ward dropped from 18% to 2%. Hundreds of women who would have died from childbed fever survived. The evidence was undeniable, overwhelming, and irrefutable. The medical establishment responded by dismissing the doctor, rejecting his findings, and eventually driving him to madness and death in an asylum at age 47. His name was Ignaz Semmelweis, and his crime was proving that doctors were killing their patients. Ignaz Philipp Semmelweis was born on July 1, 1818 in Buda, Hungary, the fifth of 10 children born to a prosperous grocer. His father, Josef Semmelweis, owned a successful shop and expected Ignaz to join the family business. Instead, Ignaz chose medicine, enrolling at the University of Vienna in 1837 to study law before switching to medicine in 1838. He excelled in his studies, particularly in anatomy and pathology, earning his doctorate in obstetrics in 1844. By 1846, at age 28, he was appointed assistant to Professor Johann Klein at the Vienna General Hospital's first obstetric clinic, one of the largest maternity wards in Europe. It was a prestigious position, and Semmelweis threw himself into the work with enthusiasm, unaware of the horror he was about to confront. The Vienna General Hospital operated 2 obstetric clinics side by side, both serving poor women who could not afford private care. The first clinic was staffed by male physicians and medical students. The second clinic was staffed by midwives. Both clinics admitted patients on alternate days, so women had no control over which clinic they entered. The difference between the 2 clinics was stark and terrifying. In the first clinic, between 10 and 35% of women died from puerperal fever, also known as childbed fever, a disease that struck within days of delivery, causing fever, abdominal pain, and rapid death. In the second clinic, the mortality rate was 2 to 3%. The disparity was so notorious that women begged on their knees not to be admitted to the first clinic. Some gave birth in the streets rather than risk it. Semmelweis was haunted by the deaths. Every day he watched healthy young women deliver babies successfully, only to develop fever within 48 hours. Their condition deteriorated rapidly: chills, sweating, intense abdominal pain, swelling, delirium, and finally death. Autopsies revealed peritonitis, infection of the abdominal lining, along with inflammation of the heart, lungs, and brain. The disease seemed to spread through the ward like a plague, claiming victim after victim. Semmelweis searched obsessively for an explanation. He examined every difference between the 2 clinics: overcrowding, ventilation, the position in which women gave birth, the way priests administered last rites. None explained the mortality gap. The second clinic was more crowded, had the same ventilation, and used identical procedures, yet its patients survived. In March 1847, Semmelweis traveled to Venice for a brief vacation, exhausted and demoralized by the relentless deaths he could not explain. When he returned on March 20th, he learned devastating news. His friend and mentor, Professor Jakub Kolečka, had died. Kolečka, a forensic pathologist, had been conducting an autopsy when a medical student accidentally pricked his finger with a scalpel. Within days, Kolečka developed fever, swelling, and infection. The symptoms escalated rapidly: lymphangitis, phlebitis, pleurisy, pericarditis, peritonitis, and meningitis. He died on March 13, 1847. Semmelweis obtained the autopsy report and read it with growing horror. The pathology was identical to childbed fever. Every symptom, every lesion, every organ affected matched the autopsies he had performed on deceased mothers. Semmelweis experienced a moment of terrible clarity. Kolečka had died from an infection introduced through a wound contaminated with material from a corpse. The mothers in the first clinic were dying from the same infection, introduced the same way. The physicians and medical students in the first clinic spent their mornings performing autopsies, dissecting corpses to study anatomy and pathology. They would then walk directly from the autopsy room to the maternity ward and examine pregnant women, conducting internal examinations with unwashed hands. The midwives in the second clinic performed no autopsies. They had no contact with the corpses. Semmelweis realized with sickening certainty that doctors were carrying cadaverous particles, infectious material from dead bodies, into the birth canal of living women, causing fatal infections. The physicians were killing their patients. Semmelweis acted immediately. He understood that soap and water, even when used, were insufficient to remove the contagion. He needed a chemical agent strong enough to destroy the cadaverous particles. After experimenting with several solutions, he settled on chlorinated lime, a compound known for its ability to eliminate the smell of decaying tissue. In mid-May 1847, Semmelweis ordered that all physicians and medical students wash their hands in a basin of chlorinated lime solution before entering the maternity ward and before each examination. The solution was placed at the entrance to the ward, and compliance was mandatory. He recorded the mortality rates meticulously, comparing them to previous months. The results were immediate and dramatic. In April 1847, before handwashing was implemented, the mortality rate in the first clinic was 18.3%. In May, after the chlorinated lime handwashing policy began, the rate dropped. In June, it fell to 2.2%. In July, it reached 1.2%, lower than the second clinic. For 2 months in 1848, the mortality rate dropped to 0. Not a single woman died from childbed fever in the first clinic. Semmelweis had saved hundreds of lives with a simple intervention, washing hands. He expanded the protocol, requiring that all instruments be disinfected in chlorinated lime solution as well. The mortality rate stabilized at 1 to 2%, a tenfold reduction. Women no longer begged to avoid the first clinic. The plague had been stopped. Semmelweis expected recognition, gratitude, and adoption of his methods across Europe. Instead, he met hostility. Professor Klein, his superior, refused to accept the findings. Klein had overseen the first clinic for years, and Semmelweis's discovery implicitly accused Klein of presiding over thousands of preventable deaths. Other senior physicians reacted with outrage. The suggestion that their hands carried disease was insulting, a slur on their professionalism and status. Physicians were gentlemen, educated and refined. The idea that they were unclean, that they transmitted disease, was intolerable. Moreover, Semmelweis could not explain why hand-washing worked. Germ theory did not yet exist. Microscopy had not revealed bacteria. Semmelweis spoke vaguely of cadaverous particles, but he could not identify them, isolate them, or demonstrate their existence. To the scientific establishment, his success seemed like luck, coincidence, or self-delusion. Semmelweis's personality worsened the conflict. He was blunt, impatient, and confrontational. When colleagues dismissed his findings, he responded with anger, accusing them of ignorance and negligence. He sent letters to prominent obstetricians across Europe, calling them murderers for refusing to implement hand-washing. He lacked the diplomatic skills to win allies or build consensus. His colleagues found him abrasive, arrogant, and insufferable. When his contract at the Vienna General Hospital expired in 1849, it was not renewed. Semmelweis had become too controversial, too difficult, and too embarrassing. Professor Klein ensured that Semmelweis would not find another position in Vienna. At age 31, Semmelweis was forced to leave the city where he had made his groundbreaking discovery, unemployed and professionally disgraced. Semmelweis returned to Hungary in 1850, accepting an unpaid position at a small hospital in Pest, the precursor to modern Budapest. In 1851, he was appointed head of obstetrics at St. Rochus Hospital, a modest institution far from the prestige of Vienna. Once again, Semmelweis implemented his hand-washing protocol. Once again, the results were extraordinary. The maternal mortality rate dropped to below 1%, the lowest of any hospital in Europe. Semmelweis kept meticulous records documenting every case, every death, and every success. His data was irrefutable. Yet the medical establishment continued to ignore him. Journals refused to publish his findings. Conferences declined his presentations. The few physicians who tried hand-washing did so inconsistently, without the rigor Semmelweis demanded, and then declared the method ineffective. In 1855, Semmelweis was appointed professor of theoretical and practical midwifery at the University of Pest, a recognition of his local success. He continued teaching and practicing obstetrics, insisting that his students wash their hands before every examination. His wards remained the safest in Europe, but beyond Hungary, his work was dismissed. In 1858, the Medical Society of Vienna held a debate on the causes of childbed fever. Semmelweis was not invited. The society concluded that childbed fever was caused by miasma, invisible vapors in the air, and that improved ventilation was the solution. Hand-washing was mentioned briefly and rejected as unnecessary. Semmelweis, reading the published proceedings, was devastated. The evidence meant nothing. The lives saved meant nothing. The establishment had decided he was wrong, and no amount of data would change their minds. In 1861, Semmelweis published Die Ätiologie, der Begriff und die Prophylaxis des Kindbettfiebers, a 543-page book detailing his findings, his methods, and his evidence. The book was dense, repetitive, and angry. Semmelweis devoted long passages to attacking critics by name, accusing them of incompetence and murder. He provided exhaustive statistical tables proving the effectiveness of hand-washing, but his tone was bitter and accusatory. The book was poorly received. Reviewers criticized its style, its tone, and its lack of theoretical explanation. Some dismissed it entirely. Others acknowledged the statistical evidence, but argued that other factors, such as improved hygiene in general, must be responsible. Semmelweis's inability to explain the mechanism, to show what the cadaverous particles were, undermined his credibility. By the early 1860s, Semmelweis's behavior had become increasingly erratic. He suffered from depression, forgetfulness, and mood swings. He repeated himself obsessively, writing endless letters denouncing colleagues. Some historians suggest he developed early-onset dementia or Alzheimer's disease. Others propose syphilis, a common occupational hazard for obstetricians who performed thousands of examinations. Still others believe he suffered from emotional exhaustion and despair, driven to breakdown by years of rejection and hostility. His wife, Maria Weidenhofer, whom he had married in 1857, watched helplessly as his mental state deteriorated. He became increasingly isolated, paranoid, and incoherent. By 1865, he could no longer function professionally. In July 1865, Semmelweis's colleague János Balassa wrote a referral committing him to a mental institution. On July 30, 1865, another colleague, Ferdinand von Hebra, lured Semmelweis to Vienna under the pretense of visiting a new medical institute. Instead, Hebra took him to the Landesirrenanstalt, a public insane asylum. Semmelweis realized what was happening and tried to leave. Guards seized him, beat him severely, and confined him in a straitjacket in a darkened cell. The asylum's treatments were brutal: cold water baths, castor oil purgatives, and isolation. Semmelweis had injuries consistent with a beating, including a wound on his right hand. Within days, the wound became infected. Gangrene set in. On August 13, 1865, just 2 weeks after his admission, Ignaz Semmelweis died of septicemia, blood poisoning caused by an infected wound. He died from the same type of infection he had spent his life trying to prevent. Semmelweis was buried in Vienna, far from the acclaim he deserved. Obituaries were brief and dismissive. The medical establishment offered no tributes, no recognition, no acknowledgement of his contributions. His hand-washing protocols were abandoned almost immediately after his death. Hospitals reverted to their previous practices, and women continued to die from childbed fever at horrific rates. It would take another decade before Semmelweis's work was vindicated, not by obstetricians, but by scientists working in entirely different fields. In the 1860s and 1870s, Louis Pasteur in France and Robert Koch in Germany developed germ theory, proving that microorganisms cause disease. Joseph Lister in Britain applied antiseptic techniques to surgery, using carbolic acid to sterilize instruments and wounds, drastically reducing post-operative infections. Lister credited Pasteur's germ theory as his inspiration, but others recognized that Semmelweis had reached the same conclusion 2 decades earlier. Semmelweis had identified contagion, demonstrated transmission, and implemented effective prevention, all without the benefit of germ theory. He had worked empirically, observing patterns, testing hypotheses, and measuring results. His methods were scientifically sound, even if his explanations were incomplete. By the 1880s, Semmelweis's reputation began to recover. Medical historians revisited his work, recognizing his genius and mourning his tragic fate. In 1906, Hungary honored him with a monument in Budapest. In 1965, Semmelweis Medical University in Budapest was named in his honor. Today, he is celebrated as a pioneer of antiseptic medicine and infection control. The tragedy of Semmelweis is not that he was wrong, but that he was right and ignored. He proved his case with overwhelming evidence: mortality rates that dropped tenfold, statistical data collected over years, consistent results across multiple hospitals. Yet the medical establishment rejected him because his findings were inconvenient, uncomfortable, and threatening. Accepting Semmelweis's discovery meant admitting that physicians had been killing patients for decades, that thousands of deaths were preventable, and that the profession's understanding of disease was fundamentally flawed. It was easier to dismiss Semmelweis as a crank, to question his methods, and to attack his personality, than to confront the implications of his work. Semmelweis's story illustrates a pattern repeated throughout history. Innovators who challenge established beliefs face resistance, ridicule, and persecution. Watt's radar was dismissed until it saved Britain. Mitchell's Spitfire was mocked until it dominated the skies. Brunel's bridges and ships were called extravagant until they redefined engineering. Harrison's chronometer was rejected by scientists who preferred their own methods. And Semmelweis's hand-washing was scorned by doctors who refused to believe their hands carried death. In each case, the innovator was proven correct, but only after enduring years of hostility and professional destruction. The pattern suggests that the greatest obstacle to progress is not ignorance, but arrogance. the refusal of experts to consider that they might be wrong. Semmelweis's legacy extends far beyond hand washing. He established the principle that medical interventions must be tested empirically, that outcomes must be measured, and that evidence should guide practice. Before Semmelweis, medicine was largely theoretical, based on tradition, authority, and untested assumptions. Semmelweis demonstrated that careful observation, controlled comparison, and statistical analysis could reveal truths that theory alone could not. He pioneered evidence-based medicine, the foundation of modern clinical practice. His insistence on measuring mortality rates, recording data, and comparing outcomes across clinics anticipated the randomized controlled trials and meta-analyses that now guide medical decision-making. The discovery that doctors could transmit disease was revolutionary, but it also imposed a moral burden. If physicians knew they could spread infection and did nothing to prevent it, they became complicit in their patients' deaths. Semmelweis understood this, and it tortured him. His letters to colleagues were harsh and accusatory because he saw their refusal to adopt hand-washing as a moral failure, not just a scientific disagreement. To Semmelweis, every physician who rejected hand-washing was responsible for the deaths that followed. This moral clarity made him uncompromising and unpopular, but it also drove him to persist when others would have given up. He could not remain silent while women died from preventable infections. Modern hand hygiene protocols in healthcare are Semmelweis's direct legacy. Every hospital now requires staff to wash hands or use alcohol-based sanitizers before and after patient contact. Signs remind workers. Compliance is monitored. Hand hygiene is recognized as the single most effective measure for preventing healthcare-associated infections. The World Health Organization promotes hand hygiene campaigns worldwide, crediting Semmelweis as the pioneer. His simple intervention, washing hands in chlorinated lime, evolved into a comprehensive system of infection control that saves millions of lives annually. The medical establishment that rejected him now venerates him. The doctors who called his ideas insulting now teach his principles to every medical student. Semmelweis died believing he had failed. He never saw his methods widely adopted, never received recognition from the medical establishment, and never understood why his evidence was insufficient to convince his colleagues. He spent his final years in mental and physical anguish, broken by rejection and hostility. Yet his failure was temporary. Within 2 decades of his death, antiseptic techniques became standard practice. Within a century, hand hygiene was universal. Today, Semmelweis is remembered not as a madman, but as a visionary, a physician who understood infection before germ theory existed, who saved lives through simple hygiene, and who fought against ignorance even when it destroyed him. The doctors who drove Semmelweis to an asylum believed they were defending medical science against a dangerous crank. They saw themselves as rational, educated professionals protecting their discipline from unscientific claims. Yet they were the ones ignoring evidence, clinging to outdated theories, and allowing patients to die rather than admit they were wrong. Semmelweis's story is a warning. Expertise without humility becomes dogma. Authority without accountability becomes tyranny, and certainty without evidence becomes delusion. The medical establishment's treatment of Semmelweis remains one of the darkest chapters in the history of medicine, a cautionary tale about the dangers of intellectual arrogance. Semmelweis must share some responsibility for his professional downfall. His abrasive personality, his refusal to engage diplomatically, and his tendency to insult opponents alienated potential allies. Had he been more tactful, more patient, more willing to explain his findings without attacking critics, he might have won broader support. But this criticism misses a deeper truth. Semmelweis was not a diplomat or a politician. He was a physician watching women die from preventable infections, while his colleagues refused to take the simple step that would save them. His anger was justified, his frustration was understandable, and his insistence on immediate action rather than waiting for consensus was morally correct. Diplomacy is valuable, but it cannot justify inaction when lives are at stake. The wound that killed Semmelweis, an infection from a cut on his hand, was cruelly ironic. He had spent his career warning about the dangers of contaminated wounds, demonstrating that infections could spread from corpses to living patients, and advocating for antiseptic practices. Yet he died from the very type of infection he had studied. Some historians suggest the wound was inflicted during the beating he received when he was committed to the asylum. Others propose he injured himself during an autopsy or examination. The exact cause is unknown, but the symbolism is inescapable. The man who discovered how to prevent infections died from an infection, abandoned by the medical profession he had tried to save. Semmelweis's life was defined by a single devastating insight. that physicians, through ignorance, were killing their patients. He proved it with data. He demonstrated the solution with chlorinated lime. He saved hundreds of lives in Vienna, thousands in Budapest, and potentially millions worldwide once his methods were adopted. Yet he received no honors, no recognition, and no gratitude during his lifetime. He died in an asylum, beaten and imprisoned by colleagues who believed he was insane. History has corrected that judgment, but the correction came too late for Semmelweis. He never knew that he had changed medicine forever, that his hand-washing protocol would become universal, or that future generations would revere him as a hero. The doctors scorned his chlorinated lime solution, offended by the suggestion that their hands were unclean. They preferred theories of miasma, cosmic influences, and constitutional weakness, explanations that blamed no one and required no action. Semmelweis's discovery was inconvenient. It demanded change, imposed accountability, and revealed uncomfortable truths. So they rejected it, discredited him, and drove him to madness. But the evidence could not be suppressed forever. Mortality rates do not lie. Women survived when doctors washed their hands. They died when doctors did not. Eventually, even the most stubborn resistance crumbled before that simple truth. Semmelweis's idea, scorned by doctors and buried with him in a Viennese grave, rose again to save millions of lives. The doctors who called him mad became history's villains, and the madman became its hero.